Let's talk about amitriptyline or TCA overdose. TCA is tricyclic antidepressant, and amitriptyline is a common TCA. There are other TCAs such as dosolapine, nortriptyline, imipramine, clomipramine, but this is the prototypic TCA. So poisoning of other agents would also follow the similar approach. So I'll discuss about the clinical features, investigations required, and the basic treatment. Starting from the clinical features, remember, amitriptyline or TCA are They are tri-blocker. They block three types of channels or receptors. First of all, they block the muscarinic receptor, they block the alpha receptor, and they also block the sodium channel, which is the most dangerous consequence of TCA overdose. So what are the features of the muscarinic blockade? The muscarinic blockade features are the anticholinergic feature or anti-muscarinic feature. Same thing. And we can remember the features by those mnemonic. Hot as a hair, dry as a bone, red as a beet, blind as a bat, full as a flask, and mad as a hatter. So hot as a hair means raised temperature. Oftentimes the patient has hyperpyrexia. Dry bone, there is dry skin and dry mouth because of decreased sweating. And that actually led to a raised temperature. Red as a beet, the skin is very flushed because there is peripheral vasodilation because it's so hot. The skin is so hot. It leads to vasodilation. So all the things are connected. Hot as a hair, dry as a bone, and red as a beet. And then it also causes mydriasis, leading to blurred vision. Full as a flask, meaning urinary retention. Mad as a hatter, meaning CNS manifestations such as confusion and hallucination. So those are all due to blockade of the muscarinic receptor. And the complications occur due to blockade of the sodium channel and the alpha block. So the most important complications are the cardiac complications, and that occur due to blockade of the sodium channel in the heart. And usually that leads to prolongation of the interval, such as QRS and QT, leading to arrhythmia. And alpha-1 blockade plus ventricular dysfunction from sodium channel blockade, both of them contribute to the hypotension. In the CNS, TCS can lead to seizure and also coma. Now, what are the investigations required in a patient with TCA overdose? The most important investigation is the 12-lead ECG. And what we want to see in the ECG? We want to see the intervals, especially QRS interval. Along with the QRS, you also want to see the QT. But QRS would be the most important interval in the ECG because whenever the QRS is prolonged for more than 100 milliseconds, the severity of the disease increases, and that is an indication of giving Sodibicarb. We will also do the ABG and the routine investigations because we have to correct any abnormalities in our treatment. So what's the basic treatment? We start the patient with hospitalizing the patient, and if the patient has took TCS and came in the hospital within an hour, we have to give the activated charcoal. When the patient comes to the hospital, the first thing we do, we attach the patient in a monitor and we have cardiac monitoring. And in the cardiac monitor, we want to see the QRS interval, the QT interval, evidence of any arrhythmias. And if they are present, then we will have to give Sodibicarb. So what are the indications? As I said before, if there is prolongation of the QRS, if there is prolongation of the QT, if there is any arrhythmias from those prolongations, and if there is severe acidosis found in the ABG. This is the pivotal step of management. Along with this, we'll also have to correct any hypoxia, any electrolyte imbalance, because they also will lead to cardiac and CNS complications. So to minimize them, we have to correct hypoxia and correct any electrolyte imbalance. If the patient develops convulsion, we can give benzodiazepines as a symptomatic treatment. In severe intractable poisoning, lipid emulsion therapy has shown some benefit. So that's all. We have discussed the TCA overdose, the clinical features, investigation, and treatment. See you in my next video. Don't forget to watch other talks videos, other poisoning videos you will find in my channel. Don't forget to like and subscribe. And please share your feeling, share your feedback in the comment section.